Welcome to ASRS's Journal of Vitreoretinal Diseases Authors Forum. I'm your host, Dr. Timothy Murray, Editor-in-Chief of JVRD. On each episode of the JVRD Authors Forum, I will interview innovative retinal researchers on their studies featured only in JVRD and how these studies will impact our patients' care in our clinics. Tune in to hear directly from investigators about the clinical implications of the newest and highest quality research in the field of retina. Welcome to JVRD's Author Podcast. We're joined today by Dr. Stephen Yeh, the professor and Stanley Truhlsen Jr. Chair in Ophthalmology at the Truhlsen Eye Institute in Omaha, Nebraska. He has a fascinating manuscript to discuss with us, Resolution of Vitreomacular Traction Following a Commercial Flight Simulator Experience. Welcome, Dr. Yeh.
Yeah, thanks, Dr. Murray. Really is great to be here this evening. I look forward to talking to you about this case.
I kind of love this. I have enjoyed some flying activities. I've been in some simulators. I've done some acrobatics. So this was dear to my heart. And certainly you and I live in a space where we're dealing with vitreomacular traction daily. So tell me a little bit about how this came to your attention. What made you think uniquely about it and what drove you to write the manuscript?
Absolutely. Tim, as you and I know, vitreomacular adhesion, vitreomacular traction can be a very serious and potentially sight-threatening condition. And we took care of a 60-year-old patient who was a really delightful lady who actually had vitreoretinal surgery in the opposite eye. But she was fearful of additional interventions because, unfortunately, while her surgical intervention was highly successful, achieving a great anatomic outcome in her prior eye, she had a scotoma. And so she was very, very concerned about potentially having future surgery. So as you know, some of these patients will develop vitreomacular adhesion or vitreomacular traction in the opposite eye. And that's what happened to her. And so she was very frightened about anything that was invasive. And her visual acuity had declined fairly rapidly to around the 20/60 level. And in this context, we talked about the various options, including vitrectomy. And so she was very, very anti-surgery. And so as fortune would have it, I spoke with my fantastic colleague, Dr. Ed McGill, and we talked about several patients that he had seen who had ridden this flight simulator in Ashland, Nebraska. And it's a very realistic flight simulator. It's at the Strategic Air Command and Aerospace Museum in Ashland. And these patients actually had developed posterior vitreous separations or posterior vitreous detachment after riding this flight simulator. So after some discussion with the patient related to surgery, observation, and ultimately taking a ride on this flight simulator, because of everything we know about the physics of the vitreous, the vitreoretinal dynamics that can happen, she actually rode the flight simulator. She had somebody who could actually drive the flight simulator who was actually a military pilot. And so this really combines a lot of what we know about the acceleration, deceleration changes that can ultimately lead to shear stress at the vitreoretinal interface. And so she had full resolution of her vitreomacular adhesion and improved the 20/25 level. It was really fascinating.
And you had beautiful imaging, which I think was really key because we hear these anecdotal stories, but typically we don't have the pre and the post high resolution macular imaging that really nails it for us as clinicians.
Right. Yeah. This is something that we, when I talked to her about her images, and this is one thing that you and I know is very fascinating, also very important from a teaching perspective, is we can talk to our patients about vitreomacular adhesion and what's happening. And this is actually something that I was showing her as I was actually talking to her about surgery. What it ended up showing was it showed that she had resolution of her vitreomacular adhesion after riding on this flight simulator with all of the barrel rolls and the different facets of the simulator that this commercial flight simulator actually offered.
I think that's key. Now, it really also addresses some of the concerns that we have. So patients will often ask me, can I be on a roller coaster, or should I, do other activities that potentially are not directly traumatic to the head or the eye, but have this indirect stress that may affect the vitreous? What do you tell them? And did this change your thoughts a little bit on that?
Tim, that's a great point and a great question that we get very frequently. And I think that it even goes back to what we think about historically, even the component of ocular rest and bilateral patching in the context of retinal detachment, how much we know that there are forces at play within the vitreous. I think it really has, again, demonstrated the dynamic nature of the vitreous. Certainly when there's something that's happening acutely from a vitreous separation perspective, I do tell patients to avoid anything where there's rapid eye movement, acceleration, decelerating changes in the setting of an acute process. Now, that being said, I don't have any restrictions during regular, like when there's not something acute that's happening. But in the context of this flight simulator, one of the things that was also very unique was that it offers not only acceleration, deceleration in a singular plane, but also this angular velocity change and this rolling phenomena, where essentially you have this change that happens in multiple planes and in this angular plane as well, which I think was actually unique to this component. But some patients I know will actually move their eye around to elicit a flashing light, and I just tell them to try not to do that, although it seems like it is tempting for them.
Well, I do think it's also important that for our patients that may be listening, that these commercial level flight simulators are not what you see at the mall. So you really do need, some guidance if you're going to do this. And I think that it's interesting because you could argue that there is relatively little risk to this prior to a surgical intervention. And think of this in a way as a staged approach. Are you sending everybody out to the flight simulator now who has vitreomacular traction?
Yeah, that's a great question and a great point. I think that what was interesting is that, again, we saw this. The question was whether this was a real mechanical change or whether this was a coincidence. And if you look at just the natural history of how PVDs evolve and timing, it's on the order of weeks to months, not days to weeks. And so as it stands, I think that if we take it on the premise that this is a real mechanical change, which was what this timing really suggested, it also suggests, as you mentioned, some level of risk. And so I don't recommend that somebody go out and do this per se. On the other hand, if they are fearful of surgery, because we know surgery is highly successful, then perhaps it's something that one would consider. And as you mentioned, it's not something that you see in the mall for pediatric age individuals without a seatbelt. This is a real unique flight simulator type experience.
And one of the things that this always reminds me of is that when the first paper started to come out focused on vitreomacular tractional surgery, the complication rate was actually not insignificant. Mm-hmm. Bascom Palmer with Dr. Flynn's paper had almost 1 in 4 or 1 in 5 patients developing a retinal detachment after surgery. That number was strikingly higher than I had heard previously. And I think they selected a unique cohort of patients to look at. But I always like to think of what's the worst thing. And the nice thing about this approach is that if you were going to operate, you were going to operate. And that may have prompted you to be prepared to do something unusual.
Yeah, absolutely. And I think that, again, we've heard this anecdotally, but that being said, the patient also knew that there was some risk to going out there in this flight simulator experience, not only from the standpoint of what's happening with the vitreous and the vitreoretinal interface, but also thinking about other aspects. This is something that somebody shouldn't go on if they have a cervical spine issue or back issues, things like that. So there's multiple other considerations, including the retina, but also related just to physical ability and well-being to sit through one of these experiences.
Yeah, they talk about cardiovascular disease, pregnancy. There's a lot of things that you have to be mindful of. Now, did you write your patient a prescription? How did you coordinate this?
No, well, it's fascinating. I mean, this site in Ashland, and I haven't visited the site previously, although I need to. This was something that we just chatted about, and again, the patient knew of somebody who could actually fly or work on this flight simulator in a very highly skilled manner, and we just chatted about it, talked about it with myself, Dr. Ed McGill, and certainly I credit the medical students at the time, Dr. Nate Ashby and Dr. Tim Cafton, who helped put this together. But ultimately, this is something that we suggested that she could go out to this flight simulator experience and just try it out. And she did, and it worked out very, very well.
Well, Dr. Ye, fascinating. It's insightful in terms of the mechanism of release of vitreomacular traction and the potentials for non-invasive management. I really appreciate your thoughtfulness and your time and spending that with us to discuss this paper today.
Yeah, thanks so much, Dr. Murray. It's always great to speak to the ASRS community, and I look forward to other observations that may come out and stimulating further discussion.
Thanks for tuning in to the JVRD Authors Forum. You can watch and listen to more episodes on the ASRS YouTube channel and on popular podcast directories, including Apple Podcasts and Spotify. Visit www.asrs.org/JVRD forum on the ASRS website to learn more. See you soon.